I'm Dr. Robert S. Brown, a psychiatrist treating soldiers with PTSD at Fort Lee, Virginia. This is an educational tape that I'm making for you, and I want to use an informal format in the same way that President Franklin Roosevelt during World War II would often have what is called fireside chats on the radio. And he used many words of encouragement to help not only the soldiers but the nation get through the difficulties of World War II. I'm going to talk to you today about emotion and how emotions can be understood and controlled. There's probably nothing worse in PTSD than the painful emotions that soldiers attempt to deal with. As a matter of fact, they attempt mostly by trying to avoid them. And so they develop a sense of numbness. They try not to feel anything and simply try to be numb. They do this in a variety of ways, primarily by staying busy. If they can be occupied from the time they wake up in the morning, and sadly sometimes in the middle of the night, until they go back to bed in the evening, they're keeping their thoughts out of their mind and simply acting robotically with no feelings. Emotions, though, can be vital sources of information. For example, the emotion of anger is very often a signal of underlying anxiety that has not been understood. The emotion of sadness is a sign of a loss of some type. It may be the loss of a friend or a loss of self-esteem or the loss of rank. Joy is an emotion that means that we're pleased, usually with something. But soldiers who've been in horrible combat are confused by their emotions. For example, the other day a soldier told the group therapy that he's a member of that he was watching a cartoon, a goofy cartoon with his son, and he noticed he had tears in his eyes. And he said, "Gee, what's wrong with me? I'm choking up just while watching a cartoon." And he said the more he thought about it, he realized there was something very touching in the cartoon between the father and the son. And he realized then that he had many guilt feelings about being away from his son so much as a result of all the deployments he had had to endure. Now, emotions can be a source of discomfort, and so it is natural to try to minimize them or to keep them out of one's awareness. But the emotion of fear, for an example, is often an indication that some danger is around us. I want to help you understand the relationship between your thinking and your emotions. Almost all emotions are preceded by a thought of some type. The thought could be very quick and passing only momentarily through one's mind, but the emotion is very real and strong and can be overwhelming. For example, you're familiar, I'm sure, with the term a trigger. Let's say that a thunderstorm could be a trigger that would cause a severe fear and shaking, maybe even trembling that something dangerous is going to happen, because that sound of thunder in a storm was very similar to explosions in combat. But so the thought was, I'm in danger, and the emotion was a horrible feeling of fear. But if you can take a moment and look at your thought and say, is this thought really true? Am I back in combat again? And the answer, of course, is no. It's not true. I'm having an emotional reaction to a thought that is not an accurate or truthful thought. So we want to get into the habit of trying to trace your emotions back to a thought that you may be having. The thought could, as I said, could be very quick and hard to grasp in the beginning. But if you get into the habit of every time you have an emotion, whatever it is, ask yourself what went through your mind just before that emotion. And you will get good at capturing what the thought was. And as I said, there are many triggers around you all day long. You'll have a trigger and an emotion. You need to go back to that trigger and its association of provoking a thought that has caused the emotion. So let's give us a chance to look at some of these, at the application of this model in some of your situations. A soldier told me recently that he woke up from a severe nightmare. The nightmare was very disturbing. It had a lot to do with what he actually went through in combat. One of his soldiers was seriously injured He was not present, but one of his non-commissioned officers was with the soldier and was in touch on the radio with the patient. And he talked him through the situation all the way through the treatment and through the soldier's death. And so he wakes up in the middle of the night shaking in a pool of sweat, and he's had this very real life reliving of the emotion that he had when he was actually in combat in Iraq. Now, he doesn't want to bother his wife, who is also disturbed by the situation he wakes up in. So he says that, well, there's too much on her mind already. I don't want to tell her about this bad dream because I don't want her to be worrying about me. So he has this nothing but pure emotion and physiological consequences of the emotion preceded by the thoughts that occurred in the dream. Now, of course, if we do a reality check, he needs to orient himself, and sometimes this takes a little time. You may find that it takes several minutes to realize that you're in your own bed, that you're not in combat, that you don't have fellow soldiers around you, that it's your wife in bed next to you or nearby you. And so as you slowly reorient yourself and identify where you are, no longer in danger, then you can say to yourself, well, that's just a dream. And I'm going to remember that dream. As a matter of fact, I recommend that if you have a phone that will take dictation, simply grab your cell phone and dictate into it the content of the dream, and then bring that dream to your therapist. In our case, on Thursday mornings at 10 o'clock, we have a dream interpretation group, and you can bring that dream and play it or repeat it for us, and we will give you an understanding of what that dream actually means. Of course, it's a dream of helplessness. It's a dream about being in a dangerous situation where you're losing and have in fact lost one of your key personnel, and you could do nothing about it. And so there's a lot of guilt associated with these kinds of feelings. And we can often find themes in dreams that are very much like the feelings that the soldier has in the daytime. A feeling of guilt, a feeling of helplessness, a feeling of shame. One soldier said recently that he used to notice that women were staring at him, and he thought that was good because they liked him or maybe had an interest in him. Now if someone stares at him, including a woman, he has this emotion that they think he's odd, there's something wrong with him because he's got PTSD. Of course, there's nothing about PTSD that's visible, that shows itself to another person, and so they could not possibly understand that you have PTSD unless you told them about it. Now, this same soldier was a combat medic. We know that combat medics, they have to go to the scene of the trauma while everybody else may be running away from it. So he has a vehicle with resuscitation equipment. He might have some assistants with him, and they get into a vehicle and go as fast as they can to render aid to the injured soldier. And his heart is pounding, and he wants to do his job, and his job is to save lives. And his adrenaline is running, and he comes upon the scene that everybody else has run away from. And he can go through all the steps that he's been trained to do to help make sure this person is breathing, that they have an open airway, that they're not bleeding to death. A lot of things he can do as a medic. Even though he's not a physician, he can do a lot of things and get that person to help. What happened to him in this particular case was that the injured person was one of his best friends. And he became, of course, very involved in this. And he and his assistants were giving a two-man resuscitation. And he was pounding on the person's chest, and his friend was doing the mouth-to-mouth breathing. He noticed that one side of the soldier's head had been blown off by the explosion. And when he pressed on the chest, brain material came out. And those with him said, it's too late. And he said that the sergeant major and the colonel and his assistant, they left the room that they had been doing the work on this soldier in, and he was there by himself. And that's the picture that keeps coming up in his mind, this trauma where he felt somehow responsible for his best friend's death. He remembered how they had photographs made before they left, and the photographs would be used in the instance of having to be identified because of an injury or death. He knew this soldier's family, and here he is now almost paralyzed with all these mixed feelings, confusing feelings, guilty feelings, feelings that he does not want to have. And he's had these feelings for 5 years. Now, I share this story with you because the most important thing is what he did not do. And that was, he did not look at what he did right after his friend died. I encourage you, if you're dealing with a trauma, to try to remember what happened immediately after the trauma as a way of identifying your feelings and your thoughts about the trauma now. So I asked him, what did you do right after that? And he said, it's funny you would ask that question. And I said, why is it funny? He said, well, everybody else left, but I wouldn't leave. And I said, what did you do? And he mumbled something. And I said, I didn't hear you. Did you say you put your hands on him? And he said, yes, I put my hands on him. And I said, why did you do that? And he said, I don't know, but I wanted to touch him. And I said, what did you do with your hands on him? And he said, I prayed for him. And by remembering that, he began to feel different about what had happened. He had had some sort of a closure about this situation that he had totally forgotten. Now, he's had many different jobs since he's come out of the Army. He's made lots of money, which has had little meaning for him, but he hasn't understood the emotions, and so he has run away from his emotions and has lived for 5 years with a feeling primarily of numbness. Now, these emotions, they have a 24-hour potential of acting in a way that could be called destructive, because they contribute to irritability, to anger and rage. They can contribute to intolerance for stupidity, and you can see stupidity anywhere. You can go to a grocery store and notice the clerk is not checking out your groceries in the right way, or maybe even putting things that can be broken into something that could easily break them in the same bag, that sort of thing. Now, I'm encouraging you now to try to do two things. The trauma needs to be revisited, especially in a safe environment with someone you trust. You have to become attached to that therapist first. And I want you to review the DVD that we made on attachment psychotherapy for PTSD. And when you feel like you're in a safe place, review the trauma, but more importantly, review what happened right after the trauma. Let me give you another brief case history. A lot of these things have to do with dreaming. And dreaming pretty much is a rehashing of what we went through during the day to some extent. Every dream has a dream day content element in it. I have a soldier who has had very disturbing dreams for a long time, and he was a forward sniper with the Marine Corps. And he's had lots of problems within his family, primarily because he is distant or absent emotionally, or what is called the 1,000-mile stare, where he's simply looking off into space, probably going through his mind a lot of the horrible things that have happened, and his family is trying to engage him, and he's not even emotionally there. And so there have been some major problems with his teenage daughter, with his son, with his wife, and these do not let up, because when he finally does go to sleep, there are these horrible nightmares. Recently, he purchased a dog. Actually, not purchased. He went to the dog pound at Fort Lee and picked out a dog as a birthday present for his daughter. But he said, I noticed the first time I saw that dog, I felt connected to the dog. He said, I brought the dog home, gave it to my daughter for her birthday, but the dog followed me everywhere around the house. He said, I went to bed at night, the dog slept on my feet. And he said, as long as he's been there, I've not had a nightmare since he's been sleeping on my feet. He said, the second night he was there, he woke me up because he was growling in his sleep, almost as if he were having a nightmare. But he found a connecting or attachment link with this pet. And he felt that in some ways, although he didn't tell me this, I suspect the pet was like an early warning signal for him, a kind of a weapon, a kind of a battle buddy substitute. And he's been able to sleep peacefully since he got the pet for his daughter, which is now his pet dog. And this is working out and has been successful now for a number of months. Pets are very important figures for attachment. I have a patient who has a bird and a cat. That's all she has. She's been deployed 3 times. She's not been injured, but she's had some major health problems since her deployment. One time she was so severely depressed, we had to hospitalize her because she was having suicidal thoughts. And she said the only thing that kept her from driving off the bridge was the cat and the bird that she left in her apartment that no one would take care of. So find, if you can, somebody ideally, and secondarily some pet that you need and who needs you to help you understand your emotions. It's been said that 40% of people who own a dog will confide in their dog, will tell the dog things they don't tell anybody else. When you decide that you want to stop being busy and you want to start looking at your emotions to understand them, try to do this, as I've said, in the context of a therapeutic relationship with someone that you feel safe with, who is not judging you, and someone you can trust. I'm looking at some notes that I've made with patients while I was talking to them in order that I can cover this topic more thoroughly. Almost without exceptions, soldiers who've been in combat, who've been traumatized by combat, tell me that they cannot deal with crowds, they cannot deal with stupidity, and they have many frustrations during the day. But one other theme that goes through their minds a lot during the day is a sense of disappointment. They say they're disappointed in many people around them, but the most painful part is they're disappointed in themselves. The family does not view them like they were before. One soldier told me his wife said that he was sick. He said, "I don't feel sick. I've got PTSD, but I don't see this as a sickness." So there's a shattering of one's self-esteem if they have a lot of disappointment in themselves. One soldier told me that his mother said that he was simply having temper tantrums. It made him feel like a child. Now, I'm going to summarize this in just a minute to help you understand that emotions are a valuable source of information for you. The worst thing you can do is try to avoid your emotions. The best thing you can try to do is to try to understand them. And you can understand them by primarily getting to the habit of capturing the thought that's connected and precedes and causes the emotion. Once you do that, you can deal with the flaws in your thinking. We want you to learn how to think about how you're thinking, because the errors that you're making in your thinking are the ones that are getting printed into your life as emotions. This is all done, as I said, in the best context of some therapist with whom you feel a strong attachment. All right, good luck and keep in touch with me.